Hello, everyone. I'm Sayukta from Vistas Media, your host for today on Hair, All Issues Resolved YouTube channel. We go through a lot of looks beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Malika Sachdev, live from Chandigarh. Dr. Malika Sachdev is a renowned consultant dermatologist, MD, Dermatology, Venereology, and Leprosy, MBBS, and she has 30 plus years of experience. She has completed her MBBS from University of Mumbai in 1987, MD in Skin Venereology, Dermatology, and Leprosy from Postgraduate Institute of Medical Education and Research, Chandigarh in 1992. Dr. Malika Sachdev practices at Skin Cosmetology and Laser Clinic. She has been practicing both clinical and cosmetic dermatology for almost 3 decades, and the response from her patients is overwhelming. It's a pleasure to have you, Dr. Malika Sachdev. A very good afternoon to you. Hope you're doing good.
Thank you so much for inviting me and saying such kind words. I'm
It's a
looking forward to
pleasure.
this session, and I hope I can answer and clear some queries and doubts of our little angels who are going to be asking us questions.
uh, we are sure that we are going to have a very informative and successful session. So let's begin this session without wasting much of the time. And Dr. Malika, as today we are going to talk about hair and how to manage hair. The biggest problem is that we all will agree on that we all shed hairs on a daily routine. But when to start thinking that okay, so this is not normal, so how much hair shedding is considered normal?
See, this is something which I'm sure most of the people who listen to it will find it frightening because they would not agree initially. Whenever we tell our patients this number, they don't agree with us. But the natural shedding is from 50 to 100 a day with no apparent hair thinning. So this sentence is very important, that there is no apparent hair thinning. So if people start getting used to the fact that this is a normal phenomenon, half our patients would stop coming to doctors because then they realize this is normal. Not that it happens 50 to 100 every day. There are periods when it is maybe 5 to 10. Sometimes it goes up to 10 to 40 and then maybe 100, because we have a hair cycle which is called anagen, catagen, telogen cycle. So it depends at what stage of that cycle a person is at that time. So when they're at that telogen phase, that's when the hair is the shedding phase. That's when it suddenly increases. That doesn't mean it's falling and it won't come back. The cycle, what does the cycle mean? It's going to come back to its reparative cycle, and you'll start growing new ones again. So 50 to 100 is absolutely normal. It's when it goes beyond that much and it persists for long periods of time, and the patient starts seeing a change in her scalp or his scalp, and they find that there's thinning, their scalp is showing up, the quality of the hair is becoming different from what they used to have. That's when the panic button should set in, and we should then meet a dermatologist.
So, from what you just said, we can, say that in a very layman term, गिरेगा फिर वापस उगेगा, लेकिन उससे पहले ये देखना जरूरी है कि ये जो नॉर्मल है 50 टू 100, ये तो ठीक है, इसको लेके पैनिक नहीं करना है। लेकिन अगर ये लगातार गिर रहा है और आपके स्कैल्प पे आपको दिख रहा है कि थिनिंग हो रही है, then is when you need to be really concerned and go and consult a dermatologist. Anyways, you can go to a dermatologist any point of time, but हाँ, उस वक्त तो बिल्कुल देर नहीं करनी है अगर आपको थिनिंग दिख रही है।
Now after because देर करोगे तो जो जितने बाल झड़ जाते हैं उतना ही मुश्किल होता है उनको वापस लाना। सो वेट नहीं करना। जब आपको लग रहा है कि वाकई प्रॉब्लम है तो जो ट्रीटमेंट है वो टाइम से शुरू कर लो तो रिजल्ट्स उतने ही जल्दी आ जाते हैं।
Very well said. And the very common mistake that we often do, especially with our hair and skin, is that we will go to the doctor when it's really alarming. Otherwise, I mean, we'll first go and try some home remedies. We'll otherwise go to the chemist and ask for some over-the-counter medication or cream or anything, or any oil or any shampoo or conditioner, with whatever they are claiming. And when we see that, okay, nothing is happening or ज़्यादा ही worse condition होता जा रहा है, then is when we will go and consult a doctor or dermatologist. लेकिन ये नहीं होना चाहिए.
To add this little tidbit to what you said, people have started using ginger and garlic juice and onion juice on their scalp. to bring back hair. So I think this is a small little bit I would like to add. Please don't do that. You'll burn your scalp. Whatever less hair you have, they will never come back. So please do not use घरेलू nuskas, as they say, on your scalp. You don't want to burn your scalp.
एग्जैक्टली घरेलू नुस्खे भी अगर करने हैं तो पहले डॉक्टर से पूछिए, क्योंकि हो सकता है या तो आपको उससे एलर्जी है, या जिस तरह से डॉक्टर कह रही है गार्लिक, जिंजर और अनियन, यू नो, जूस, दे आर रियली हार्श, दे कैन बी रियली हार्श ऑन योर स्किन, ऑन योर स्कैल्प. तो प्लीज ऐसा कुछ भी मत कीजिए जो आपकी कंडीशन को और वर्स करता हो. प्लीज गो एंड कंसल्ट अ डॉक्टर, दैट्स रियली इंपॉर्टेंट. एंड डॉक्टर, आई एम श्योर हम इतने सारे लोग हैं, हम सबके बाल हैं, किसी के बाल ज्यादा झड़ते हैं, कम झड़ते हैं, अलग अलग रीजंस होते हैं. तो आई एम श्योर जो कॉजेस हैं वो भी बहुत सारे होते होंगे hair loss के. तो in general अगर हम बात करना चाहें, what are the causes responsible for hair loss?
Yeah, as you said, it's a huge armamentarium of causes, and it starts with as simple as something like hair styling products, hair drying, blow drying, chemical usage, frequent color changing of the scalp, perming, you know, hot drying. So these are small things which we need to understand. These cause a lot of damage to our hair. So we have to take care that we first, one of the main causes initially in the young new generation is that they interfere too much with their hair. So I think that's the first thing we should get across, because that is something which is rectifiable. You know, this is not a disease. Then of course comes the disease spectrum. Now, when it comes to the disease spectrum, there are multiple reasons. Right now, the most pertinent is post-infections. We are seeing so much of COVID and dengue and, you know, with all the monkeypox, any viral for that matter, in which there is debilitation, which means कोई ज़्यादा बीमार हो जाता है, उसके 2 to 3 months बाद एकदम बाल झड़ते हैं. So कोई भी infection हो, typhoid, viral, jaundice, इन चीजों से बहुत commonly होता है. Then commonly pregnancy or abortion. 3 months post-pregnancy, women lose hair. That is called postpartum telogen, which most women should be aware. It is because of the stress of pregnancy. During that time, the hair stops forming. This hair takes about 3 months to come to the roots, and then they fall like there's no tomorrow. So they don't need to panic. It is due to the stress of the pregnancy or even an abortion, you know. So that's a very common cause in, you know, in ladies. A third cause which we have started coming across is dieting. A lot of children are now dieting, going to nutritionists and going for diet programs, not realizing that when they reduce their protein intake, they are now losing hair 3 months post-dieting. So if you need to diet, please exercise and eat a nutritional, you know, diet along with it. That's how you need to lose weight.
Right.
Then you come on to hormonal diseases. So many children in today's day and age, girls have PCOD, polycystic ovarian disease, which is very common. Thyroid is very common. First, it used to be more in females, but now males are as commonly involved. So any hormonal change like this causes hair loss. Then you'll end up with diseases of the scalp. Now, there are a lot of diseases in the scalp like alopecia areata, which are small patches of hair loss in the scalp or beard, which people say keeda lag gaya, which is not really a keeda, but that's how most people understand it as. That is called alopecia areata. That is a cause of hair loss. Then you have hair loss due to fungal infections of the scalp. That is something which the Indians are really going through a bad phase right now. A lot of people have fungal infections. Then you have hormonal changes like male pattern baldness or female pattern baldness. That is when males start losing their hair on the front, which is even common in women. It's not only seen in men, it is very common in women also. So those are called patterned baldness. So that's another huge cause of baldness, which is even seen in the young group. People think you bald later on in life, but that's not true. You see the younger generation between 18 to 24 also balding. You see women going towards their menopause, they start balding in the front. So that is another very important cause of hair fall. So as you can see, there are a lot of drugs which cause hair fall, a lot of antidepressants, drugs for Parkinson's, anti-cancer therapy, you know, all these cause, you know, after radiation, chemotherapy, that's when you lose hair. So that's a very important reason for, losing hair. So I think I've kind of covered most of them, but
yes.
I must have missed a few here and there, but generally this is what we need to. So you have to have a very good history to know what you're dealing with. Hair loss doesn't mean a simple problem. There could be multiple causes for, you know, the fall.
Right. We often say that, you know, our hair is the mirror of our health. हमें कोई डेफिशिएंसी होगी तो वो हेयर पे दिखेगा, कोई हेल्थ रिलेटेड इश्यू होगा जैसा आपने बताया तो वो हेयर्स पे रिफ्लेक्ट होगा। हमारी जो हैबिट्स हैं, चाहे वो हमारे बालों को कोम्ब करने को लेकर है या उसमें अलग अलग तरह के प्रोडक्ट्स यूज करने को लेकर है या अलग जो सैलून बेस्ड ट्रीटमेंट्स होते हैं उनको लेकर है, वो भी हमारे बालों पे रिफ्लेक्ट होगा। तो कुल मिलाकर अगर बालों में कुछ भी हो रहा है तो इट्स very important that we go and diagnose कि क्यों हो रहा है, and only a doctor can help you in that. इसीलिए हम बार बार कह रहे हैं घरेलू नुस्खे ना अपनाएं। हो सकता है किसी पे वो काम कर गया हो, लेकिन हो सकता है वो आप पे ना करे, और अगर आप पे नहीं करेगा तो बहुत ज्यादा उसका नुकसान आपको झेलना पड़ सकता है। हो सकता है किसी और को डेफिशिएंसी की वजह से हुआ हो, उसने कोई सप्लीमेंट लिया हो, उनके बाल ठीक हो गए हो, लेकिन आप वही सप्लीमेंट्स लेंगे तो हो सकता है वो आपके लिए बहुत नुकसानदायक हो। तो इसलिए हम बार बार कह रहे हैं प्लीज गो एंड कंसल्ट अ डर्मेटोलॉजिस्ट बिफोर इट्स टू लेट, बिफोर you go with hardly few hairs on your scalp to the dermatologist. So be very careful about your hair. और हम डेफिनेटली बात करेंगे ही आगे कि किस तरह से मेडिकल मैनेजमेंट या नॉन सर्जिकल मैनेजमेंट हेयर लॉस का हो सकता है। Now doctor, to move forward, what is the medical management of hair loss like?
Yeah, just as you said कि सबसे पहले patient has to be investigated और एक अच्छी हिस्ट्री लेना सबसे जरूरी है इन क्लिनिकल प्रैक्टिस। हमारी आधी प्रॉब्लम्स, हमारे आधे क्वेश्चंस आंसर हो जाते हैं इफ वी स्पेंड टाइम एंड फाइंड आउट कि कॉज क्या है। सो वंस यू गॉट अ हिस्ट्री ऑफ अ पेशेंट एंड आपने उनसे बात करके पूछा कि उनका रूटीन, डेली रूटीन क्या है, वो क्या यूज करते हैं, प्रोडक्ट्स क्या करते हैं, then you can make out कि is that one of the causes? If not, then we go deeper, find out कि पिछले 3-4 महीने में क्या वो बीमार हुए थे, क्या उन्होंने जैसे डाइटिंग करी थी, क्या उनको ब्लड लॉस ज्यादा होता है पीरियड्स के दौरान, which could be a cause of anemia and hair loss. Were they unwell? Did they have any emotional stress during that period? A lot of children go through so much of emotional stress. Right. Once we have done all this history taking to find out what we could possibly pin down to, and if we don't get too many answers, then we go into the investigations, जहाँ हम उनके blood tests करते हैं. Okay. Blood test में we generally go in for, it's a very simple test. We generally go in for an iron test, vitamin D, B12, and zinc analysis, and a general count to see whether they have any infection in the blood or the body. So these kind of give us an idea where do they stand. We get a thyroid profile done. If we suspect PCOD, then we get a whole PCOD profile to see whether they have any hormonal imbalances, because in girls, if you have PCOD, the first thing that happens is hair fall. So right. Once you have done the investigative process and you've kind of pinpointed what is the cause, then we rectify that cause. So that is the second way of managing that comes into the investigation. A lot also is seen by the type of loss. Now, if you find a boy who has pattern baldness on the top of his scalp, you know he's having baldness. Mm-hmm. Women also, many women have baldness on the front. So that is called pattern baldness. So the treatment for that is entirely different. That we handle in a different manner. So that helps us. There are other tests, like we now do a lot of dermatoscopy. That is a kind of, it's a little magnifying glass which enhances the size of the pores on the scalp, tells us what could be the underlying cause of the disease in the scalp. Is there anything? Sometimes there is a hair loss, which is scarring. Scarring means that the scalp has totally gone blank. There, you will not get any hair on it, even if you try your level best. So with that dermatoscopy, we can make out, are we wasting the patient's time? Should we properly counsel them to tell them there's nothing much we can do? And, they should go in for a wig or a transplant. So examining the scalp is one of the other causes. And of course, a general, if we feel there's a liver disorder or something, then we go into deeper investigations. So that's how we come to a conclusion as to what that person is suffering from. And then we rectify those things so that we can help them bring the hair back. And if done properly, we are successful in a lot of, major percentage of patients.
Right. So diagnosing the problem is one of the major, I can say, milestones. Once the problem is diagnosed or the causes are diagnosed, then you can actually move forward and decide what to do about it, how to go for it, like for medical, non-surgical or surgical management of hair loss. So we would like you to shed some light over medical management, of course, and non-surgical management of hair loss as well.
So as we said, it all depends on what we found, right? So if we found a deficiency state, of course, the first thing will be to add iron tablets, zinc tablets, biotin tablets. whatever we found in the parameters, we found the patient deficient. We found him to be a hypothyroid patient. We start them on thyroid therapy. If it's PCOD, we start them on, oral contraceptives and aldactone. These are all hormonal therapies to kind of counteract what caused the acne. Once we have kind of sorted that out, then naturally the hair starts growing back. So that really helps us in the overall treatment. Then we come to the pattern baldness, like baldness, which boys and girls face. There we have a different approach because there it is not deficiency. That is a sensitivity to a hormone called DHT, dihydrotestosterone. So here we are targeting hair follicles to stimulate new follicles. So here we need to give them a tablet which generally contains finasteride in men or in perimenopausal women. So that helps in the DHT attack on the hair follicles. Plus we add serums and minoxidil. Minoxidil is a salt which is one of the mainstays of treatment in these pattern baldnesses. So we have a variety of them where they vary from 2 to 10%, and in men we stick to 2 to 5%. Men we go up to 10%. So we apply those lotions on the scalp, and that helps to stimulate and thicken the hair follicles, along with tablets like the Finpatia we are talking about, which is basically finasteride. So for those pattern children, we need to go on to this treatment. This treatment goes on a little longer because here baldness is something which is an ongoing process. You might find that boys and girls may have to use minoxidil for years together to keep the hair going. So that is another part of the treatment, which is a long-term treatment. Obviously, the other things we find, if we find there's any sort of a hormonal imbalance, other than that, we tackle that. So this is kind of medically what we treat.
Right.
Then we come into the non-surgical, as you asked. There are newer techniques available now called PRP, which is plasma regeneration. We take out the patient's blood, we spin it, take out the stem cells and the platelets, and then we inject it onto the scalp. This stimulates, the stem cells stimulate new follicles. This is something which is a new kid on the block. Then we can go in for derma roller, which has, small pins and needles on a roller. We roll it on the scalp, and then we put stem cells on the scalp so that penetrates deeper into the layer. That causes hair stimulation. Then there are lasers, basically, which are also meant to stimulate hair follicles. So this is the non-surgical approach for hair loss.
Right. And then we, of course, have surgical, ways to manage hair loss. What are those, doctor?
So surgical, we don't do it normally in people who have hair loss due to deficiencies and all, because that is rectifiable. So that hair loss is called telogen effluvium, which is self-limiting. With treatment, the patients grow back their hair. So we don't use that. We generally use this for people who have pattern baldness, like male pattern, like young boys and old men. So that we take their own hair from the back of their scalp, because the back of the scalp is the area where hair never degenerates. It always grows. So we take them out and then we implant them on the frontal area where the patient has lost his hair. So that hair has a lifelong hair span, in the sense it goes and comes. It doesn't degenerate, or it doesn't atrophy. Atrophy means it doesn't become small and miniaturized. So this hair grows like our hair forever. So there are multiple techniques involved, of course, now, but that's the basic crux of it, that you can implant your own hair back into the scalp. Nowadays, people are even some people don't have too much hair on the back of the head. So now plastic surgeons and, trichologists are even taking out hair from the beard or the chest and implanting it onto the scalp if they have less hair on the back of their neck. So that's how new hair can be transplanted, and that should be done. Now, this is something I would like to please reiterate, has to be done by someone who has a good hand, because you may have to spend a little more money, but make sure that the person has a hygienic surroundings, is good at his job, because it all depends on how well the job is done. So a good transplant surgeon with a good hand, with a clean environment, so there's no secondary infection. That is the key treatment in this, because it's a surgical treatment. Here you don't want to have any sorts of secondary. There was lots of panic in the South earlier when patients died of infection on the scalp. So this should be something that you should be very aware. Find your surgeon and make sure you're comfortable, and it should be a clean place to get it done. So I think that covers the non-surgical aspect. It's basically a hair transplant in one word.
Right. So with surgical management, patients have to be, more aware, careful while choosing the doctor. You can go through reviews, etc., and go to the best one. Go to the one who really has a good hand, and there you can, find a place to end your problems. So we have so far spoken about the medical, non-surgical, and surgical management of hair loss. Now, doctor, we all know that it's equally important. You also have mentioned at the beginning that it's important to eat right, because when you eat right, your hair will get the nutrition, etc. Now, we would also like to understand the role of nutraceuticals in hair loss.
See, nutraceuticals is a new kid on the block. We used to give natural product. Earlier, we were giving, biotin, vitamin D, and all that. But now we've found that even smaller little things like nutraceuticals can add to the health of the hair. There are lots of new products which are in the market. Things like curcumin. Curcumin is basically haldi. Then you have things like sop or saw palmetto, which is also another extract from plants. Then you have vitamin E. You have ashwagandha. There are small new things. These are all called nutraceuticals. So when they're put together, they are kind of like a cocktail of small products which nurture the hair, which help you to, it stimulates your immune system to fight back. It stimulates our stem cells. The only problem with nutraceuticals is there is no clinical trial to pinpoint and say, do they work by themselves? That is the only issue which needs to be proven. There are a lot of trials on other products, but these new things, we don't have too much to compare with others. So we presume they are working. And I'm not saying they're not, because I've also been using them for the last 5-7 years. And I do find they do help in the luster of the hair, the quality of the hair. So these little things added on is always beneficial. 1 + 1 always makes 2. So why not do? And they have no side effects. They have nothing. They're not bothering you in any way. So there's no harm trying them as long as you know what you're taking. Having said that, when you go to any site selling these products online, you'll find that a lot of products are claiming things which you should be very careful against. Now, any product will have vitamin A, E, C, selenium, biotin, everything in it. They don't realize that many people are already on multivitamins. Adding on these to them, too much of vitamin A, too much of vitamin E causes hair loss. So indirectly, you are creating a problem because you're not aware that what you're eating is in the right quantity. You are over-medicating yourself. So we need to know where to draw the line. So it should be under medical supervision. You are not to do pill popping. Because they're so freely available now. There's so many blogs and there's so many, influencers and so many people talking about things. Patients don't know what it is. So this has to be under medical cover. Take them in the right proportion, under guidance, and then you'll benefit out of it. So you need to know over of anything is not too good for you either.
Exactly, excess of everything and anything can be bad to us. So I think सबसे ज्यादा ध्यान इस बात पर देने की जरूरत है कि आप जो भी ले रहे हैं उससे पहले डॉक्टर से कंसल्ट जरूर करें. जैसे कि आपने डॉक्टर कहा कि कई लोग जो है विटामिन सप्लीमेंट्स जो है खास तौर पर ओवर द काउंटर ले लेते हैं. खासकर बालों के साथ तो ये बहुत होता है. अच्छा, बाल झड़ रहे हैं, बायोटिन ले लेते हैं. बाल झड़ रहे हैं, जिंक ले लेते हैं. बाल झड़ रहे हैं, आयरन डेफिशिएंसी होगी ही. ऑफ कोर्स विटामिन ए, विटामिन सी, ये तो हमको पता ही है कि ये जरूरी है हमारे बालों के लिए, हमारी स्किन हेल्थ के लिए विटामिन सी. तो विल जस्ट गो आस्क द केमिस्ट की बायोटिन दे दो. ऑनलाइन आप ले सकते हो, कहीं से भी ले सकते हो. द एक्सेस इज सो इजी. लेकिन हम ये कभी जानने की कोशिश नहीं करते कि हमें एक्चुअली किसकी डेफिशिएंसी है भी या नहीं. एंड वी, जैसे आपने कहा, एंड अप ओवरफीडिंग आवरसेल्व्स विद दोस विटामिन्स, और अति भी खतरनाक हो सकती है. तो वही होता है, एक्सेस ऑफ एवरीथिंग कैन बी बैड. तो इसीलिए बहुत जरूरी है कि हम डॉक्टर के पास जाए. और न्यूरोस्यूटिकल्स के बारे में डॉक्टर ने हमें बताया ही है कि भले ही क्लिनिकली कोई इसके ना हो, लेकिन साइड इफेक्ट्स नहीं है क्योंकि ये नेचुरल तरीके से एक्सट्रैक्ट किया गया है. लेकिन अगेन इसके लिए भी आपको डॉक्टर के ही पास जाना है. ये सबसे इम्पोर्टेंट बात है. एक और बहुत आम प्रॉब्लम जो लोगों के साथ होती है डॉक्टर, डैंड्रफ. नाउ, does dandruff cause hair fall is another very common question that people often ask. What's your take on that?
Yeah, now that you brought this topic up, I would like a few clarifications in dandruff, which I would be very happy if everyone would get some knowledge out of this, because this is the most mismanaged, misconstrued problem in India.
Right.
So one question answer, yes, it can cause hair fall because obviously it's damaging the scalp and the hair roots. So it is one of the causes of hair fall. We must make sure that, of course, we treat it primarily. Dandruff is misconstrued in India. There are three kinds of dandruff, as we call flaking. It does not mean it is the oily kind only. A lot of people have the dry kind of dandruff. That is not normal dandruff, that is psoriasis. So you need to understand that you need to differentiate the disease, whether it is seborrheic dermatitis, which is the dandruff which you call, or it is psoriasis, which is a disease. Treatment for both are entirely different. So you cannot pitch the same answer or the same treatment to both the diseases. So this is one major myth. So secondly, you have to differentiate now what do you have and then treat it accordingly.
Right.
Number three, people think dandruff is dryness and you need to put oil to counteract it. Let me clarify. Dandruff in our language is called seborrheic dermatitis, which is a glandular or oil gland overactivity. So it is happening due to oil overproduction. There is a growth in our scalp. There is a fungus called Pityrisporum which grows on that oil, and that causes the infection called seborrheic dermatitis or dandruff. So please do not use oil to counteract dandruff, because indirectly you are increasing your dandruff problem. So this is a very important thing in dandruff. Please don't do oiling. This is not helping you in any way. No oil penetrates your scalp. We don't have holes in our scalp that they would penetrate and nourish your scalp. What you eat nourishes your scalp. So in dandruff, oil is a zero. Number two, always wash with cold water. Hot water tends to stimulate oil glands, causing further dandruff. Frequent washing is good for you because you have to keep your scalp oil-free if you don't want that fungus to grow on your scalp. Not only with, you'll find that with dandruff, you're also, acne and dandruff coexist, you'll end up with a, pimply face. So make sure that you wash frequently, and anti-dandruff shampoos, you can speak to your dermat and get something which helps you. So dandruff is a small thing. I've kind of enucleated in 4 words. You just need to be careful about these 4 things and you'll be sorted.
Right. And as you mentioned that, if you have dandruff, use a appropriate shampoo as advised by the dermatologist. The problem is that in the market, there are so many, shampoos claiming that they can make you dandruff free, make your scalp dandruff free. And they are really harsh. They can actually, make your hair really frizzy and dry. Now, with all the market gimmick and with all the influencers and, YouTubers, etc., what would you like to tell our viewers not to, fall a prey to these traps or these glamorous ads, etc.?
Yeah, I think I'm not belittling them. I'm sure they know what they're doing, most of them. But the point is that, small things, I personally feel being influenced by clothes and jewelry and all that is fine. I mean, that's something you enjoy doing. But when it comes to influencing by virtue of medicine, influencers and computers and Googles and Safari and Chrome are not your friends. You need to go beyond that because you really don't know what you're asking for. And every person has a different problem. It's not a blanket statement. You may be different from me. I may be different from a third person. Our problems are different. Our scalp is different. Our oil glands are different. Our color is different. Our city is different. Our climate is different. Our intake of food is different. Our age is different. How can you, categorize everyone into one, category and say this will work for all of you? So influencers and all, I think you should need to draw the line. When it comes to medicine related things, I think you should just stop listening. The rest, go ahead, do all you like with all your fashion and, your this thing. But medicine wise, it will harm you in the long run. It's not worth taking that risk. So I think everyone should understand where to draw the line between health and wellness. Yeah.
मुझे हर बार ऐसा लगता है कि किसी को अगर चेस्ट पेन होता है या लग रहा है कि कार्डियक अरेस्ट आ रहा है या कुछ ऐसी प्रॉब्लम है, तो विल गो एंड कंसल्ट अ कार्डियोलॉजिस्ट. अगर नहीं मिल रहा है, एटलीस्ट विल गो एंड कंसल्ट अ फैमिली डॉक्टर एंड से कि हमको तुरंत किसी अच्छे कार्डियोलॉजिस्ट का नंबर बताओ. हम कभी किसी इन्फ्लुएंसर का सुन के उस वक्त इलाज नहीं करते हैं. हम ओवर द काउंटर की चेस्ट पेन हो रहा है बहुत ज्यादा, कोई दवाई दे दो, ऐसा नहीं करते हैं. मोस्ट ऑफ द टाइम विल गो एंड कंसल्ट अ कार्डियोलॉजिस्ट. ऐसे ही दूसरे हमारे जो ऑर्गन से उनसे रिलेटेड प्रॉब्लम है, विल गो एंड consult a whatever, an expert, but doctor. लेकिन स्किन एंड हेयर को लेकर हम सबसे आखिरी में डॉक्टर के पास जाते हैं. We'll go and do, we will, first thing we'll do is run into the kitchen, get something, दादी माँ के नुस्खे, and start applying it. Again, otherwise we'll go to a chemist and ask for some over-the-counter medication, or keep popping in some supplements, etc. और जब लगता है कि अब तो बिल्कुल ही हमारे कंट्रोल में नहीं है, कुछ बहुत ज्यादा हार्म हो चुका है, तब हम डॉक्टर के पास जाते हैं. बल्कि होना इसका ठीक उल्टा चाहिए. अगर प्रॉब्लम है तो पहले आप एक्सपर्ट के पास जाइए, डॉक्टर के पास जाइए, क्योंकि इस सब में आप जो मेहनत, पैसे, एनर्जी सब खर्च करते हैं ना, वो सब आपका बचेगा, प्लस आपके बाल बचेंगे इस केस में. जो आप जब तक दूसरी चीजें करते करते डॉक्टर के पास पहुंचेंगे, हो सकता है बाल ही ना बचे. इसलिए प्लीज इनको भी लाइट मत लीजिए, अपने बालों को, अपने स्किन को लाइटली मत लीजिए, अपने स्कैल्प को लाइटली मत लीजिए. कुछ भी प्रॉब्लम है, गो एंड कंसल्ट अ डर्मेटोलॉजिस्ट. जो भी करना है उनसे पूछ कर कीजिए, वो ज्यादा अच्छा होगा. And doctor, whenever we talk about dandruff, तो आपने बताया कि किस तरह से dandruff होता है और किस तरह से हमें उन्हें डील करना चाहिए. अलग अलग causes भी होते होंगे dandruff के. कई बार winters में बहुत ज्यादा dandruff होता है, या मानसून जो कि आप चल रहा है, आपने फंगल इन्फेक्शन के बारे में भी बताया था. अगेन मानसून में बहुत ज्यादा फंगल इन्फेक्शन होता है, कई बार dandruff भी बहुत देखने को मिलता है. So what are the various causes of dandruff, और क्या नहीं करना है आपने बताया, और क्या कर सकते हैं जिससे इससे हमें निजात मिल सके?
Basically, you have to understand it's an oil overproduction. So one, you have to make sure that you don't apply oil. You keep your scalp free. People tend to wash their hair and not their scalp. The problem is in the scalp. So जब सिर धो तो एटलीस्ट अपनी स्कैल्प को धो. लोग डरते हैं कि बाल झड़ जाएंगे तो स्कैल्प को नहीं टच करते, बालों को धो के निकल आते. No, wash your scalp so that it is oil free. Once it's oil free, obviously the secondary fungal infection will not happen, which is the dandruff. And as I said, it's a sexual thing also, because these in youngsters, when your hormones are pipping up, that's the time when, because the oil glands work overtime, you get infections. So during that pubertal phase of children between 10 to 18, that's the time when children get dandruff in excess. So that's the time when they need to take care. As you said, winters may it increases. Why does that happen? Because in winters, the body, as a reflex mechanism, in an attempt to get rid of the dryness, produces more oil. And as the oil gets produced in major quantities, the secondary bacteria, the fungal infection grows. That Pityriasporum fungus grows and it causes dandruff. So that is a reaction to the temperature, because the temperature has gone up. People tend to have a bath with hot water. That stimulates it further. So basically, there are only 2-3 things. It's basically hormonal. People who have extra oil glands from the beginning, they tend to get it quicker. And these 2-3 things aggravate it, like the oiling, the hot water, the temperature, winters. This is what aggravates it. Otherwise, there is no major problem. Some drugs, of course, people who are on antipsychotics, antidepressants, those people also gland up. There are a lot of drugs which cause dandruff. But those, of course, are because of the intake of the medicines. So, if you take, and then as we said, there's another disease called psoriasis, in which there are white thick flakes. That is a genetic disorder. You're born with it. Once it shows up, it comes on once or twice a year. For that, you have to take medicines, apply medicines and a shampoo, and that goes away, comes again. So that is something which is a proper disease, like which you have to, like you have diabetes or thyroid. You have to respect it as a disease and treat it as and when it comes. I loved you for saying all that about, how people come last. Dermatology is not taken seriously. It's the most frustrating thing for us doctors. When we see people doing what they've done, it requires a lot of patience from our side not to get angry with what they have done. So I wish what you said permeates to everyone, that shouldn't take it lightly. It is a part of your body. The skin is the largest organ of your body.
Exactly.
It involves the hair, skin, nails, mouth, tongue. Every part of the body is a part of the skin. Respect it. Please don't take it lightly. So that statement of yours really touched my heart, because most of us really feel that part. At least we dermats feel that a lot.
Yeah, I can completely understand what you're saying. So I think the bottom line is, respect your skin, respect your scalp, respect your hair, respect your body, and take care of it. Don't abuse it. That's going to really harm you ultimately. Doctor, we would also like you to burst some myths regarding hair fall and graying of hair as well.
Yeah, so now myths is a never-ending process. One, first we'll start, is oiling beneficial? No, nothing permeates, as I said. Whatever you apply on your head, I'd rather you eat it instead of putting eggs on your head and whipping up mayonnaise and putting on your head. I'd rather you eat all that because all your nourishment comes from within. It's what you're eating, the multivitamins, the tomatoes you're putting on your head. I'd rather you eat those carotenes. So please make sure that you don't keep pumping things onto your head. You're indirectly, ruining your scalp. You're changing the pH of your scalp.
Right.
Number two, people have this thing, can we wash every day? Yes, of course. There is no problem. The hair is like a tissue, like our body. We have hair on our body also. Men have hair all over. They bathe every day. Nothing happens. They don't lose that hair. So washing hair daily there's no problem as long as you're using a shampoo which is gentle on the scalp. You shouldn't use shampoos which are very harsh. They kind of dehydrate the hair and cause the cuticles to dry up and become frizzy. So a gentle shampoo daily is no problem. Number three is conditioning good for your hair? Yes, it's not going to nurture your hair, but it tends to tone down the frizz because it's covering the cuticle. It's a temporary thing while you have it on. The minute you wash it off, it gets washed off, but there's no harm. Make sure you only apply it to the length of your hair. It should not touch your scalp. Is applying serum good? No problem again. It tones down the skin. Tones down the hair, sorry. It softens it. So doing that is another problem. Nothing, there's no harm doing it. Blow drying, hot blow dry, not good for your hair. Again, dehydrating the cuticles, making it more frizzy and your hair will break. So you must make sure that you use a cold hair dryer. Coloring the hair. See, the problem is too much coloring is going to harm your hair in the long run. Just make sure you just color just up to the roots. Don't tend to apply the color on your scalp. When you go professional, they kind of coat your scalp with color. That kind of harms the scalp. It's irritating the scalp. So make sure you just do root touch-ups as much as possible and use good quality colors. Please don't use colors which are desi, which you have so much available in the market. Stick to a good brand. Ammonia-free colors do help to a certain extent because the chemical content is less, but it does not, it doesn't belittle the fact that you are using a color, right? So, it doesn't really help. If you have allergies to a particular dye, you will have it to all of them because there is a product in it called paraphenylene diamine, which is present in most colors. There are few vegetable colors available in the market. So a person who has a dye allergy should avoid that totally because it can cause a lot of problem. And you should stick to these vegetable colors. They're not as good, but you can come by them. You can make do with the dark brown color which you have. Applying henna, another myth. It ruins the hair. Please don't apply henna. If you really go and see a photograph, microscopic photograph of a hennaed hair, you'll die of shock because the coating of henna on your hair is killing your hair follicles and dehydrating your cuticle. So please do not use henna on your hair. It's better to use color. If you're using good color, it will just coat your hair. It's not going into your scalp, so it's not harming your scalp. Just coating it from outside is good enough. What else? What other myth I would think? Can you think of something which I would be missing? Any question? Hair cutting. Some people think that no, hair cutting is good because you should get rid of your splits. Split ends should be cut regularly. Otherwise, it's split up and it will cause your hair to look frizzy and damaged. So regular haircuts twice or thrice, after every 2 to 3 months is good for your hair. It keeps the roots healthy, because you're not splitting them upwards. Right. Another thing people feel is that if you shave off your scalp, you'll get good quality hair. That is not going to happen because your hair is underneath the scalp, way below, many millimeters below. The bulb is there. By cutting your hair on top, you are not touching the bulb. So you're not going to increase or improve the quality of your hair. So please don't do that. You're not really helping yourself. People feel if they cut their gray hair, and the next hair will be black. No, once it's grayed for life. Forget about it. Another myth they have is coloring hair causes excess graying. No, it doesn't. Okay, your graying is there because there is either some deficiency or you have a family history of premature graying or you've been ill. So your follicles have lost their pigment. So by you coloring it, you are not increasing it. So please go ahead. Don't feel guilty that you're increasing it by coloring. So that's another myth which most people have about coloring. Anything? I'm sure the questions will come up from
yes,
YouTube about this,
You've actually answered many of the questions, because Sonia Sahu was asking that how come haircuts will help me grow and hair grows. You have already answered her. Ankit Chaurasia was asking, can split ends be treated? So yeah, you can keep on trimming them. That's the way. You have already answered it. Shraddha Kapoor was asking, should I wash my hair every day? no problem unless and until you are using a gentle shampoo. So yeah, you have almost answered most of the questions.
Another thing I need to clarify: patients feel that if a shampoo has lots of lather, that's a good shampoo. That myth that needs to be removed, because lathering is not what cleans the scalp. There is a product called SLS, sodium lauryl sulfate, which is the lathering agent, and that's not good for our hair. It dehydrates our scalp. That is the one which foams, but that doesn't clean. A non-lathering shampoo is what is free of SLS, and that cleans as well as others. So your shampoo having less lather is good for you. So next time you pick up your shampoo, criteria should not be how much jhag there is. It should be a good quality, SLS free, paraben free, and something which has a less lather and foam. It's as good and will keep your scalp clean, and you can use it every day also. That's another thing. So it helps, especially once you've exercised and you're sweaty and you swam or you have an oily scalp. Washing every day is essential. These shampoos are the best for you.
Exactly. So the important thing is to keep your scalp clean, and for that you of course need to wash your head, not your hair, not just your hair, but your head, your scalp. Clean your scalp, and for that of course you need a gentle shampoo, no harsh shampoo. So again, be very careful while choosing a shampoo and conditioner. And doctor, I think from the viewers part, you have actually answered most of the questions. Sama Khan was asking, are dry scalp and dandruff the same thing?
No. Dry scalp is people who have less oil, natural sebaceous oil in their hair. It does not mean dandruff. So that is where the doctor comes in. Dandruff is something which will feel sticky, oily. It will be stuck to your scalp and to your hair, and it might cause itching. And when you're running or this, you might cause that pinching kind of a sensation, or it has symptoms. So the patient will feel uncomfortable. That's when it becomes a disease. If it's just dry, it does not mean that you have dandruff.
Okay, so you have in a very short and to the point manner busted all the myths and debunked the, fact, the truth. That was really very informative and I'm sure very helpful for our viewers. Before we sum up the whole session, doctor, what are the important tips for healthy hair?
See, I generally talk that it is holistic. Like we all say, everything works together. A good diet, good quality products, a good mental health, exercising. These small holistic things add a huge change to a person's, hair health. Of course, other than, those big list of things I told you about, the diseases, let's put that aside, that we've covered. But other than that, a good quality balanced diet, which is rich in proteins. People who diet tends to stop their proteins. Please don't stop your proteins. Things like, I'll just give you an example. I mean, the common man would want to know what I should eat. Something like, milk, curd, paneer, dal, mushrooms, soya, sprouts, dry fruit, egg whites, chicken, fish. These things in Indian diets, we have everything. We are luckily blessed. We eat everything. We have so many dals. It is sasta. There is no, you have peanuts. You don't have to go in for dry fruit. You can have peanuts. So having a balanced diet is very important. People who have iron deficiency don't have to go in only for the iron pill. You can have things like palak, methi, saag. You have, carrot, your bananas and apples. You have black chanas. We have so much black chanas. Just steam them and have the soup of the chanas. All these are rich in iron. So, these small things which are a routine in our lives, we just need to add a little bit of that to it. Eat well, remain, relaxed, exercise, and don't fool around with your hair with too many products and all. Our body does not require care. I tell all my patients that, we take so many pangas with our face, we do so many procedures, and that's the part which gets damaged most of all. We don't do anything to our arms and legs, and we never get any problem there because we are not fidgeting with it. Our scalp and face is where we are changing the pH of the skin with too many product usages. It is very simple. Ask our grandmothers, they did nothing. So stick to just normal routine schedules, eat well, it will work. I promise you, this is with 30 years of experience, I can tell you, it is as simple as that. And of course, when you have a disease, we're always there for you. But otherwise, you don't need anything more than that.
Right. So keep it simple, eat well, sleep well, relax well, exercise well. And in case you have any problem, even if it sounds to or seems to be very small, please go and consult a dermatologist. Please go and consult an expert. Please go and consult a qualified dermatologist, doctor before it's too late. So don't delay there. Thank you so very much, Dr. Mallika Sachdev, for your valuable guidance. It was wonderful talking to you, and your advice on how to keep our hair healthy, especially in the current scenario here, where apart from the other environmental and genetic factors, the increasing levels of pollution and stress are also taking a toll on our hair health. Your information, your valuable guidance was very helpful. I'm sure your guidance will help our viewer, and they'll have healthy hair and healthy scalp from now on. Thank you so very much once again.
Thank you so much for giving me an opportunity to at least put my thoughts across with my little patients. Thank you so much.
It was wonderful. Thank you. And for viewers who want to get personal consultation from Dr. Mallika Sachdev, you can visit Skin Cosmetology and Laser Clinic, Chandigarh. And a big thank you to all our viewers once again for watching the show. And for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved. Thank you. Goodbye. Good day to all of you.
Thank you. Bye.
Bye-bye.